Ahana's baby book, my little darling, my little angel, my little monster all rolled into one. Look at this picture here. She's already a little rock star. This is Ahana and her cousins when Ahana was just 6 months old. She's a brat. She would laugh at the smallest of things. She could have long, long conversations with her crib mobile. Ahana is a very calm child right now, but as a baby she would cry and wail in the night, and there was nothing I could do to calm her down. I mean, a lot of first-time parents like me think it's colic, right? Nothing to worry about.
And then, around her first birthday, a bite of a beautiful cake and Ahana was breaking into hives. Tummy upsets and throwing up, growing pains, right? Many very expensive tests and many specialist visits later, we knew Ahana was allergic to both milk and wheat.
Ahana is allergic to milk.
Milk and wheat allergy, no big deal, right? But the problem is pretty much everything Ahana eats, like this dahi, butter, cake, bread, biscuits, roti, everything is off the table. What am I going to feed her?
And then I started meeting other moms at birthday parties. Moms who also knew a number of children who had food allergies and were groping in the dark for answers. Ahana is one of the 200 million children world over who suffer from food allergies. But just what is a food allergy and how does it work? Allergies occur when your immune system becomes confused. Instead of ignoring harmless substances, it mistakes them for a foreign agent like a virus or a germ. It starts to defend itself by creating little warriors called antibodies. The next time you ingest the same harmless substance, the body releases a chemical called histamine. It is histamine which causes the classic allergy symptoms.
Food allergies are overall increasing all over the world, and nobody really knows why they're increasing, but it's basically an allergy in which a body responds to the protein component of the food.
The most common food allergies world over are milk, soy, wheat, eggs, chickpeas, fruits like eggplant, banana and even apple, shellfish, peanuts or tree nuts. But how do you know what you are allergic to? I'm meeting a fellow allergy mom, my friend Anu.
Hi, how are you? So nice to see you again.
Her son Siddharth is 1 year old. Siddharth today has a healthy appetite for everything. But as a baby, Anu says he was sick quite often.
What is that? Milk. He was a very, very colicky baby, and he was also preterm. So what actually happened was that he was in a lot of pain, he was crying a lot, and then after a point we actually found out that he even had perianal fissures, and they looked really painful, and of course he was crying a lot every time he passed motion. So then we decided we really need to do something about it. This is not just colic.
What Siddharth was displaying are typical food allergy symptoms that include hives, swelling around the mouth and vomiting, a runny or blocked nose, breathing difficulty, eczema, stomach pains or diarrhea. In infants, it can also lead to a failure to thrive. Severe food allergy reactions, especially to peanuts, can lead to what is called anaphylaxis attack.
Anaphylaxis reaction is the most extreme form of an allergy. The basic concern there is that the child may have edema of the airways and he is gasping for breath, and in addition there could be a drop in his blood pressure. So this is an emergency situation and you need to treat them immediately to get them back.
But the discovery that these symptoms can actually be a result of food allergy was a long and exasperating process for Anu.
When we first suggested it to a very well-known doctor here, he said as long as you have like a liter of milk a day and you're nursing your kid, he should be fine. And then we actually changed about 3 pediatricians.
There's a lot of confusion out there in the minds of parents and doctors. But for the doctor, if he's finding that there is a common complaint that's going on and on, not responding to standard treatment, or investigations have failed to find a cause, he must think of an allergy and then look into that aspect much more carefully.
Since Anu was breastfeeding Siddharth, she had to go off everything: milk, soy, wheat, nuts. After months of struggle, Siddharth was thriving, but things got difficult for Anu.
I was on calcium supplements and everything, and I faced a lot of problems, you know, like bone spurs. I once had such a severe sort of sprain and went to a hospital, and that guy was like, your hand looks like a 60-year-old person's joint. It was just almost hollow because I wasn't getting enough calcium. So I had to up my supplements.
Anu and Siddharth are coping well today. Anu's become a bit of a whiz in the kitchen, even baking him an eggless, milkless cake on his birthday. And now that she's not breastfeeding, Siddharth is on a special hypoallergenic formula.
We found a formula which is not available in India, so we have specific chemists who will source it from exporters, and it's superbly expensive with custom duties and everything together.
Well, you know, I found out about Anu and Siddharth at about the same time that I was discovering Ahana's allergies. So were these children just popping up all over urban India, or was there actually a drastic rise? Well, there's no India-specific data available, but in the UK, US and rest of the Western world, there's definitely a rise in food allergies.
What we know is that in the US in the last 1 decade, food allergies have gone up from 10% of all children to 18%. In UK, hospital admissions due to severe food reaction have doubled. With a lot of us in urban India shifting sharply to a diet of processed Western foods, allergies have also gone up. Also, how we are growing our food is directly impacting us.
Though we are getting reports of wheat allergy from all over the world, including South India, the incidence is much higher in North India because we eat more wheat. Also, the hexaploid wheat that we are now using is more antigenic. So there are more antigens on it, so definitely much more allergies will happen from it.
As food allergies increase across the world, research is on in the field of immunotherapy to make allergy vaccines. But till then, here's what doctors say can help reduce the incidence of food allergies. Longer breastfeeding, eating a lot of fresh fruits and yogurt during pregnancy, traditional food and spices in Indian food can help reduce use of disinfectants at home.
You know, now in big cities and in big stores like these, you have entire sections that are dedicated to allergy-free food. So you have these options in big stores, but you still have to be a voracious food label reader, and as a parent, that has to be your job.
The words we allergy moms have to memorize are crazy. For milk, look out for words like whey, casein, lactose. Soy is mainly found in Asian cuisine. Look out for miso, natto, shoyu. For wheat, look out for breadcrumbs, cereal extracts, semolina. Wheat is also sometimes found in soy sauce, starch and glucose syrup. For egg, words like albumin, eggnog, lysozyme are used. Egg is found in a lot of baked goods. Remember, when in doubt, just leave it.
Let's go to school, darling. We have to first pack your bag.
Once you know your child has food allergies, you have to make sure they understand it. You have to make your friends and family and school understand that your child has allergies that are serious.
Okay.
It's a festival celebration at Ahana's daycare, but her caregivers know that they have to be careful with what they give her. On the menu put up on the notice board, there are special dishes marked for Ahana. She gets to sit with her friends and eat the meal they are eating, except her puris are made of gluten-free flour. She surprises me with her ability to say no to what is bad for her.
Sandwich is not good for her. Only my face can eat sandwiches.
coming up after the break.
If I eat anything, I start vomiting and I get swollen.
We take your questions regarding allergies in children to the best doctors in the field. We've been talking about food allergies in India, but now let's shift focus to other allergies. In children, allergies tend to follow a certain pattern. Those with food allergies and eczema as toddlers are likely to have asthma and hay fever as adults. Experts say dust, dust mite, pollen, wheat husk and animal hair are most common allergens in India. Allergy-induced asthma has seen a drastic rise in India in the last 3 decades, with 25.5% of children suffering from it. What's worrying is that prevalence of persistent asthma, which needs medication, has gone up to 72.5%. We organized a web chat on our website IBN Live/Living It Up, and we are taking your questions, your concerns to the best doctors in the field.
Hi Dr. Kishore. I find people my age suffering from airborne allergies that refuse to go even with changing season. Can you tell me why?
Thank you for your question. It's a very interesting question. In India, there is a variation in seasons. So there's a certain season when there is increased viruses in the air, there are increased pollen at the time of harvesting, and these seasons around April, May, and then again around September right now are times when we find an increased incidence of allergies, and this is because of increased airborne pollen and airborne stimulants which cause allergies in children.
Hi Dr. Kishore, this is Preeti here.
Hello.
My daughter Anushka is 5 years and has been suffering from allergies for the last 2-3 years. We've heard about these shots in the US. Do you reckon we could give her these shots as well?
Allergy shots are useful in the US and in UK primarily because allergies over there are related to a single antigen or a single allergen. In such cases, allergy shots do have a role to play. However, in India, most allergies are multifactorial and they're dependent on many allergens. So it is practically not very useful to desensitize children to multiple allergens, and the efficacy and usefulness also in such situations is limited.
Thank you, doctor.
Hi, Dr. Singh. I'm Meher, and I am severely allergic to dust mites. My question to you is, does homeopathy work on allergies against dust mites? People swear by homeopathy, but I have my doubts on how it works.
Homeopathy helps in 2 aspects. One, it helps raise the immune system of the person so that they can easily fight with the allergens in the atmosphere. And secondly, if you have already developed the allergy, it helps clean up the disease completely and cures it from deep within, along with giving us symptomatic relief. Per se, if someone is getting a dust allergy, so if they get sneezing, rhinitis, watery eyes, it also helps decrease the symptoms, and gradually over a period of time, it's a long-term process which will help you get rid of the allergy completely.
Okay, I've just been doing a web chat and I've got many questions regarding milk allergy and lactose intolerance. Milk allergy basically is allergy to the protein in the milk or things made from milk, even maybe burfi. But in lactose intolerance, you are intolerant, not allergic, to the lactose, the sugar component in the milk. By and large, what we see in children is that the lactose intolerance is transient and usually occurs after a bout of gastroenteritis, that's a bout of diarrhea. But it lasts 2 or 3 weeks, during which period these children will tolerate only small amounts of milk, but dahi and lassi would be just fine.
10-year-old Kritika and her 14-year-old sister from Bangalore love playing a game of tennis. They also have lifelong allergies to eggs and nuts.
I'm allergic to nuts, dry fruits, cow milk, egg. If I eat anything, a bit also, I start vomiting and I get swollen. I realize myself that I get very severe stomach aches when I eat egg.
They want to ask Dr. Shikha Sharma about what are the options available for allergy kids so they don't miss out on important nutrients.
Thank you girls for writing into us. It really encourages us to look for more things to tell you. So people who have wheat allergy, particularly children who have wheat allergy, there is a wonderful idea. What you can do is you can have ragi biscuits, because ragi is a very good source of calcium, and it's also free from any wheat, so it doesn't have any gluten. Then for people who are allergic to eggs and they need their source of protein, alfalfa seeds is a very good source of protein. So alfalfa seeds can be sprouted, and the sprouts can be added to either moong sprouts, or they can be had as such. In case suppose a child is allergic to peanuts or any other kind of nuts, and then you're worried whether he's getting his minerals and he's getting his protein, then you can look at amaranth. Amaranth is a small seed, and this is like popped amaranth. So all these allergies, whether it is milk allergy or whether it is wheat allergy or whether there is protein allergy from nuts, there are all substitutes available. So you just have to go and find them, and there'll be no deficiency at all.